Hi, and welcome to Dr. Brainwaves. I'm Dr. Rena Azar, and today I'm going to talk to you about polycystic kidney disease. Cysts can form anywhere in the body almost. We know they can form on the ovaries, in the liver, in the pancreas, in the brain, but they can form on the kidney as well. And there's an inherited condition called polycystic kidney disease, which is important to identify and see a specialist for early on in the disease process. People can have cysts on the kidneys that are not related to polycystic kidney disease, but if you have multiple large cysts on both kidneys, it is very strong consideration that you will have an inheritable form of polycystic kidney disease. People who have polycystic kidney disease present often in their 30s or 40s when those cysts are getting increasingly large and increasingly numerous. Often they'll present with back or side pain because the kidneys are here in the mid to upper back. They will notice an increase in the size of their abdomen. Sometimes they'll notice pushing on other organs will make them feel full early. They may have blood in their urine when the cysts give off blood. And so they can see either tea-colored urine or bright red urine. And in addition, because of the cysts, they may present because they have lots of different infections, and those infections tend to be bad infections that make them sick. In other words, they're not just in the bladder, they're up in the kidneys, and they're getting kind of severe urinary tract infections frequently. That's another way that you'll find patients present. And one final symptom that we see with polycystic kidneys is hypertension. Why hypertension? Because there's a big regulatory area in the kidneys for blood pressure. And when the kidneys don't feel good, our blood pressure frequently will not be normal. So kidney disease leads to hypertension, and therefore hypertension is sometimes the first sign that there is something wrong with the kidneys. So how do we diagnose polycystic kidney disease? Polycystic kidney disease is considered in anybody who has multiple cysts on the ovaries. Without any family history or any other consideration, if you have more than 10 cysts on each kidney, then you will assuredly be told that you have polycystic kidney disease. On the other hand, if there's a strong family history or any personal history of other consideration for polycystic kidneys, which we'll talk about in a minute, then lower criteria are used. So it's usually a clinical diagnosis, but they can do genetic testing as well, because more than 90% of people with polycystic kidney disease have a particular inheritable autosomally dominant genetic form of it. So the diagnosis is generally done with ultrasound, but sometimes CT or MRI are used because those that have a little bit closer imaging can see cysts more easily, even small ones, and getting a count on those cysts is important for the diagnosis. Genetic testing is not done on everybody because it is expensive, and because about 5% of people will have what we call de novo genetic abnormality, meaning they came up with their own abnormal gene. It never came from anybody in the family, but now they have it in their genes, and they're going to be able to pass that on. So you're going to miss those folks as well. Why is it important to know about polycystic disease? Why is it important to know that if you qualify for polycystic disease? Because we know that that is a progressive disease of cysts getting larger, pushing on the tissue in the kidney, and then causing kidney damage. And unfortunately, 50% of people by the age 60 will have polycystic kidney disease-related kidney failure. 60% will have kidney failure by 70 years of age. That's really significant. Those people are going to be candidates for kidney transplants or dialysis, but there are definitely things that we can do to slow the progress down. We do not have anything that is curative for that disease process, but we have things that we can use in lifestyle and even a medication to slow the process down. Who's at risk for kidney failure if you have polycystic kidney disease? The people that we identify as having a higher risk for kidney failure ultimately are men, people who've got polycystic kidney disease with high blood pressure, with protein and blood in their urine. Women who have high blood pressure and who have had more than 3 pregnancies are at higher risk for kidney failure. People who have elevated cholesterol, people who are Black, people who have a low HDL cholesterol, people who have sickle cell trait. Those are all people who have higher risk for polycystic kidney disease progressing into kidney failure. It's an interesting fact to know that we know that because it's an inheritable disorder, we also have some other issues that we see along with polycystic kidney disease. About 25% of people with polycystic kidney disease will have an abnormality on their heart valve. And so we check people to see if they're one of those people with a floppy heart valve, because there are some heart conditions associated with that. We also know that hypertension is much more common, and heart disease in general is more common. So if you have polycystic kidney disease, you're going to be monitored for your heart health. Also, people can get cysts in the liver. Up to 75% of people as they get older with polycystic kidney disease will have cysts in the liver, cysts on the pancreas. These types of cysts can cause discomfort pushing on organs near them, but they don't generally affect the function of the pancreas and the liver like they do the kidneys. We also recognize that people who have polycystic kidney disease are at increased risk for reflux because of enlarged liver, are at risk for colonic diverticulosis and diverticulitis, and you can see videos on that as well. And we also recognize it might be nice for people who know that they have polycystic kidney disease to have a consultation for genetic testing so that they and their family members can know if anybody else is a carrier. One other risk for a problem is that about 10% of people who have polycystic kidney disease will have an aneurysm or a dilated blood vessel in the head, and certain types of those aneurysms will be at risk for rupture and for that person to have an intracranial bleed. As a matter of fact, because these are inherited conditions, when you have somebody that has multiple cysts in their kidneys, you will frequently ask, do you have family members with heart disease, with high blood pressure? Have you had family members with intracranial bleeds? That's what happens when you have a ruptured aneurysm. Have you had people that have had these bleeds inside their head that have been devastating for them? Do you have family members with heart valve abnormalities? So if we hear of that, then we say, aha, that's a tip. That person probably has an inheritable form of polycystic disease. We do not test everybody for aneurysms, although we do test everybody for heart disease and monitor them for hypertension closely. And the logic behind the aneurysm is because some people can have aneurysms that are so tiny we wouldn't want to opt to intervene unless they were symptomatic. So we give very strong consideration to testing for aneurysms if patients have a family history of aneurysms, if they're preparing for a major elective surgery, if they've had a previous aneurysm, obviously. High-risk occupations where a sudden event like that would be devastating, for example, pilots or crane operators or surgeons. And patient anxiety is another indication that we'll do aneurysm screening for. So those are some other abnormalities that we see along with polycystic kidney disease that we like to keep in mind and watch for. So what can we do if we know you have polycystic kidney disease? We can send you to a nephrologist, and that nephrologist is going to help to monitor your progression of kidney health. Things that you can do that we know are helpful is you can drink lots of water. You can avoid caffeine. Caffeine has definitely been shown to increase the size of cysts. One important thing to do is close follow-up with your doctors so that you can keep your blood pressure under control, because blood pressure being under control is an important part of your kidney health. Also, because people who have cysts in their kidneys are more likely to get severe infections, urinary tract infections, it is really important to be evaluated quickly if you feel like there's an infection in your bladder or your kidney. You can see my video on urinary tract infections, but most urinary tract infections come from the bladder on up to the kidney, and people who have polycystic kidneys are at much higher risk for getting very, very sick with that infection ascending or climbing up beyond the bladder up into the kidney and setting up camp in that abnormal kidney that has some tissue destruction and abnormalities and blood flow, and it's going to be much more of a setup for a severe infection and potentially some additional kidney damage. Also, People who know they have polycystic kidney disease may want to come in and be seen to see what options they have for management of their pain. People with polycystic kidney diseases can get ruptured cysts, that's rare, can get cysts that are so large that they're causing constant discomfort, for which they can take medication and see if they'll shrink down. Sometimes they have a procedure where somebody goes in and tries to drain those cysts, or even inject a material that will help that cyst to kind of shrink down and stay shrunk down. So pain control is an important reason to be seen for polycystic kidney disease. Also, people who have polycystic kidney diseases in general should avoid contact sports. Your kidneys are going to be more delicate than other people's kidneys. So even though exercise is good and important, it's a known fact that contact sports are not a good idea for people with polycystic kidney diseases. So though there are 3 types of polycystic kidney diseases. One is adult onset, which is, or acquired, I should say, onset, which is in people who have chronic kidney problems. That's very rare. There's an infantile version of it, and those children rarely live to adulthood. But the one that we see by far and large is the autosomal dominant polycystic kidney disease that we are now talking about. And that is an overview of polycystic kidney disease. Hopefully you'll have a better understanding of what symptoms you might have when you have it and why to see your doctor, and make sure that you know which type you have and get on your kidney health right away. I hope you enjoyed your session with Dr. Brainwaves. Thanks for visiting us.